Now, with that new heart health campaign called Hands Only CPR, it shows the simple steps that could help save a life when someone goes into cardiac arrest. Jesse Palmer is here with those very important new details. Good morning, Jesse.
Good morning, Amy. You know, growing up, we were taught that a compression of rescue breaths and chest compressions could help someone suffering cardiac arrest. But now, experts are saying hands-only CPR could be the key.
Hands. Just two hands. That's all you need to save a life. No one knows that better than these two women. Ashley was saved by her dance partner.
I call them my lifesavers.
And Dorothy was saved by her daughter.
I want people to know that CPR is really easy.
And now a new initiative is trying to empower all of us to jump in and do CPR when needed. Hands only.
It's really important for people to realize that mouth-to-mouth is no longer required. The only thing that's required to save someone's life is to do hands-only CPR.
The numbers are staggering. More than 90% of people who suffer out-of-hospital cardiac arrests will die. 70% of cardiac arrests happen at home.
We want to do nothing short of changing the social norm by empowering people with knowing what to do.
Joining this crusade, celebrities like Michael J. Fox, Juliana Margulies, Michael Bloomberg, all among the famous faces lending their hands to the hashtag Hands-Only CPR.
There are 3 steps to saving someone's life: check, call, and compress. Check to see if they're breathing, call 911, and then begin chest compressions.
Check, call, compress, and that truly it is life-saving.
Doctors stress that speed is key. If you see someone who's not breathing and you wait for medical help, well, then it's most likely too late. So that's why this campaign is about everyone learning to do compressions. Amy?
All right, Jesse, thank you. And let's bring in our senior medical contributor, Dr. Jen Ashton. So explain to us, Jen, why these recommendations changed.
So it really has to do with the statistics. There are about 350,000 out-of-hospital cardiac arrests in this country every year. The survival rate is poor. About 90% will not survive. For every 1 minute of downtime, as we say, without CPR, survival rate drops by 10%. And studies have shown that CPR save lives, and just hands only, just chest compressions save lives. So that is the take-home message.
Yeah, medically speaking, why are chest compressions alone enough to save a life?
So it's really 2 main reasons. Number one, if you witness someone drop out of a hospital, they actually have enough oxygen in their blood if it's circulated, and that's what the chest compressions are doing. The other thing is, it's been shown and known that most lay public bystanders, when they were doing the rescue breathing, were oftentimes not doing it correctly, and there would be a leak around the mouth, air would go into the stomach instead of the lungs. So again, the key is initiating CPR.
All right, so for most people, the thought of having to do CPR on someone, especially in that traumatic moment when they drop, is a terrifying thing. You've performed it many times. What advice would you give people, lay people?
In a hospital setting, this is what I would tell my interns at the first code, because even in a hospital, people are nervous. And I would tell them, this person is already technically dead. You cannot hurt them. All you can do is help. And that is really important emotionally. Logistically, this needs to be driven home. We heard it in the piece. It bears repeating. Activate 911, which means pointing to someone, say, you in the black dress, call 911. If you're on a cell phone, you need to tell the operator that, and then start chest compressing hard and fast. We have the song. A lot of people will remember the beat.
Right, okay.
100 to 120 beats per minute. You want to depress the sternum or breastbone about 2 inches. But if you forget the song or you
I always
forget
heard
the beat,
Staying Alive was one too.
Any song, but we say hard and fast. And learn CPR. If there's a defibrillator there, use it. But this should be the spring-summer missive for people. Learn CPR.
Right. Difference between life and death
100%.
in many cases. All right, thank you so much, Dr. Jen. We appreciate it.